My name is Howard J. Eisen, MD. I'm a Penn Med class of '81, and I'm a co-chair of the Benjamin Franklin Society. Why did I come to Penn Medicine? I had a number of choices in terms of where I could go, and I really knew that when I first came to Penn, when I interviewed, that this was the place that I wanted to be. It really had the most collegial and congenial environment. The students seemed to play a major role in terms of interviewing future or potential medical students, and the faculty seemed to take the students' opinions seriously and to involve them in the governance of the school. So I really like that. There were a number of really outstanding physicians. One who comes to mind is Larry Beck, who was a nephrologist and was also, for a while, was director of the internal medicine residency program at HUP. And the thing I really liked about him was that he was really the triple threat. He was a scientist, a clinical investigator. He was a great doctor. Patients really liked him. He was a very savvy clinician, and he was a great teacher, and he knew just about everything. So he was really impressive. One of the other people was Alden Harkin, who was a young cardiac surgeon. And the thing I really liked about him was that although I decided pretty quickly that I didn't have the dexterity nor maybe the endurance to be a cardiac surgeon, but the thing I really liked about him was his tremendous enthusiasm. And again, just the way that he interacted with patients. So these two people really have stood out in terms of their influence on me. And actually, many years later, I worked with Dr. Harkin on NIH study sections, and it was good to see that decades later, he still had the same enthusiasm and intellectual curiosity. So Penn is a very special place, and I want to maybe give an anecdote that kind of symbolizes why Penn is so important to me, which is that 6 weeks into medical school, my father died, and he'd had a long history of heart disease, and actually was one of the first people in the U.S. to have bypass surgery. And so I went home and, the funeral. And on the day of the funeral, got a letter from Dean Stemler, a condolence letter. And I just was stunned because I didn't tell him. I don't know who told him. But it was just the fact that he took time to do that. And then just the tremendous support that the faculty and the students gave to me. And it really just symbolized how this, how important students are to the institution, and really had an impact. And of course, my subsequent education, which I think was first rate. And again, the way the students were treated. So I think this is the kind of thing that we need to continue, and we need to make sure that the next generation, the generation after that, receives the same, not just the same great education, because you can get a great education at a lot of schools, but the same treatment as colleagues and as valued members of the medical profession. So that's why it's so important for me to volunteer for Penn. My classmates and I had a terrific education here. It really started our careers, not just in terms of educating us, but in terms of inspiring us. And this is really a special place. And I believe that it's important that we continue the school's mission of not just educating the next generation of medical leaders, but of inspiring them. And for me, this is very important. I want to make sure that future generations of students have the same benefits, have the same great experience that I and my classmates had. On a practical level, it means that whenever I come to a medical alumni advisory committee meeting, I get lost because there's always a new building or a new expansion of a building. But it really instills a lot of pride in me, and I think in other alumni, because you see how the school has grown. It's not just the buildings, but it's the people who's in the buildings, the faculty who've been recruited, the programs that have been established. So it really demonstrates how the institution has grown. And of course, the alumni didn't do all of this, but we like to believe, I think correctly, that we played a major role in terms of helping the school expand. But it also inspires us. And I think that if more Penn alumni would come back and just spend a day or two and wander around here, certainly people from my generation, they would really be inspired. I mean, it's really unbelievable, it's changed. The annual fund is crucial in terms of supporting renovation of some of the older buildings on campus, the Morgan building, the Stemler building, places where we received education, but at this point, needed to be renovated for the next generation of medical students. And renovation and support of other facilities on the medical campus. But the other important area is scholarships, and we want to make sure that we get the very best medical students, that they come here because they want to come here, because we want them to come here, but that the cost of tuition will not prevent them from coming. So that's why scholarships are crucial. In addition, Penn has many unique programs, such as the Botswana program, and we want to make sure that the students can take advantage of that, and so that also requires support. And I think that the donations to the Medical Alumni Fund help support things, unique programs like that, which allow our students to take advantage of really unusual educational experiences. The Benjamin Franklin Society comprises the really the most loyal alumni. Not that other alumni aren't loyal, but in terms of people who are willing to give commitments at a high dollar level and on a multi-year basis for unrestricted gifts. So the medical school is able to take advantage of these funds. And so it encourages alumni to get tied into the school, to increase their donations, to allow the school to make decisions about where the funds should be used, and to make a commitment that's longitudinal and not just on an annual basis. And certainly our goal has been to try to encourage that, to try to foster that, and increase the number of donors. And I think not just in terms of having these loyal alumni, but in terms of the actual dollar amount. The Benjamin Franklin Society members are the ones who really comprise the backbone in terms of donations. So it's a really crucial organization for supporting, for demonstrating alumni support of the medical school. I think the ideal time to get people to be involved in supporting the medical school as alumni is when they leave medical school or shortly thereafter. I can tell you during residency, nostalgia for medical school sets in very quickly. So that's the time to get them engaged. And obviously on a resident's or fellow's salary with the debt that many students have, it's difficult to expect them to commit to the full level of the more senior Benjamin Franklin Society members. But to get them engaged early, and at a lower rate, but to recognize their loyalty and their willingness to commit on a multi-year basis is really crucial. And I think that that's the way that you develop a group of people who will then be able to transition as they move on in their career to more senior levels and to become the next group of leaders of the Medical Alumni Association and of the Benjamin Franklin Society, and perhaps to encourage their colleagues and their classmates to contribute as well. This is Howie Eisen, Penn Med Class of '81, and I encourage you to support the School of Medicine annual giving now, next year, and in the future.